Welcome back to the Ricky Matthews Show. As I said, we have a special guest today, someone who I've been looking forward to having on the show. We're going to actually talk about two really important hidden health risks that you got to pay attention to. One is the Vibrio bacteria in water and food, and then toxoplasmosis. It's a parasite that is linked to eating undercooked game like deer hearts. Now, that sounds, for people who aren't a hunter and whatever, you say, oh, that's terrible. But people are very conservation minded when they go out and hunt for game, and they want to use as much of it as they possibly can. And there's some great recipes, frankly, for deer heart. And we're going to talk about that now. And so anyway, it's my friend, Dr. Nicholas Conger, who was just literally a regular on this show during the COVID days. We've visited once or twice since then. But he is a terrific infectious disease doctor here in Gulfport, and someone who has a terrific background. And he's kind of seen it all when it comes to infectious diseases here in coastal Mississippi. So, Dr. Conger, it's great to see you again, my friend.
Hey, thank you so much for having me back. It's always a pleasure to be on your show. You always give me the opportunity to elaborate a little bit more and talk about these infectious diseases. So I do appreciate that.
So let's do this. For people who have not heard us talk before, let's kind of lay the groundwork. Your experience in internal medicine and infectious disease, and how you got to where you are now.
So when I was in medical school, I joined the Air Force. I wanted to serve my country, and I wanted to help also pay for medical school. So it was kind of a win-win. And I joined the Air Force, and I'm very happy that I did that. And that I developed an interest in infectious disease, and doing infectious disease in the Air Force was very interesting. They sent me to tropical medicine courses. They sent me overseas to get some experience with things that we don't have normally here in the United States. And so that was a great experience. And I served for 21 years, and I lived in different places, to include Germany and Ohio, here, San Antonio. And then when I got out of the Air Force or retired, I'd been here before, and I knew that there weren't a lot of infectious disease doctors down here. And so, and we enjoyed the coast, and we enjoyed the people and the pace of living. And so we decided to come back here. So I've been here for 7 years now, primarily centered out of Memorial Hospital in Gulfport, but we kind of go everywhere and anywhere the patients are that need us.
Yeah, it's been great to know that about you. And as a result, we get the benefit of your expertise. That is for sure. But so we'll kind of jump right into it. I mean, I don't think that anyone would, typically, if you think about imagining yourself enjoying a Gulf oyster here in coastal Mississippi, that it could potentially, I know this is not the only way, and we'll get into all of it, but that you could potentially end up in the ER with a Vibrio infection. And I think, as you and I chatted before the show, for people who know a little bit about Vibrio, just because we're on the coast, you hear about it more often. You tend to think it's just for people. It's just if you got an open cut and you have a compromised immune system of some sort. If you're not in that category, you have nothing to worry about. So let's start with Vibrio, what it is, why with the more warm water that we're experiencing, how that plays into it, et cetera.
Right. So Vibrio is it's a gram-negative bacteria that likes warm, salty environments, and so it thrives in ocean water and in brackish water. And it also thrives when there's a iron source as well. And it clearly rises up during the warm months. And mollusks like oysters filter thousands of gallons of water constantly, and that's how they eat and feed and respirate. And they can actually, what they end up doing is concentrating the bacteria. And so you can get it in two ways. You can get it from ingesting oysters, particularly raw oysters, and then you can get it from cuts and scrapes, especially if something has like buildup of brackish water on it, like barnacles at the side of a boat, a dock, etc. There's a classic saying, you don't eat raw oysters in months that do not have an R. So that would be May, June, July, and August. And that's because the weather's hot. And that's when it multiplies at higher amounts. And that's when you're most likely to get sick from it.
Yeah, and I'll add September to that. I went out.
It was a hot September for sure. Yeah.
I told my wife, Ann, I said, do you remember a drier, hotter September than we've experienced? But, and some people will say, it's related to nasty water, but that's not it at all. It's about warm water. And as you pointed out, the salt content. Why don't you get more specific about that? Because it's not related to bad water.
Right, exactly. And so wherever, so it's going to be in the Gulf Coast primarily because that's where our warm waters are in the United States. But yes, it doesn't have to do. You could have crystal clear blue water could still have Vibrio in it if it's warm enough, for sure.
Yeah.
And yeah.
So I had a friend of mine. In fact, I think eventually at one point you saw him. It never was clear to me whether what he got in his finger was Vibrio or not. But it was, you may remember the case. I won't mention the guy, very close friend of mine, but he got this little bitty nick on his finger. I mean, it was nothing to speak of. And it just spread and spread and spread. And it required relatively major surgery to open it up, to get the bacteria out. And I think you saw him not long after that. But, Vibrio if you just have a cut, Vibrio can start, can it?
Yeah, right. So there's really two kind of mechanisms of action that bring it into the body. So when you talk about cuts and scrapes, that's again you're going to have to be in the water that has the potential pathogen. And when you get the cut or scrape, it can get underneath the skin and it can cause what's called a cellulitis, which is a somewhat routine bacterial skin and soft tissue infection. But you need slightly different antibiotics for Vibrio. And even in a healthy person with a normal immune system, it can be a pretty bad cellulitis, but it usually stays at that point. Now, you could still get what's called a necrotizing fasciitis, and that's when it gets a little bit deeper, gets in that fascia, and it goes along the fascia planes. That's kind of like the soft tissue in between the skin and the muscles, and it slides through that fascia, and it can spread quickly, and then it can start causing necrosis and death of the muscles. We would call that what's called necrotizing fasciitis. A lot of people colloquially say flesh-eating bacteria, and there's other causes of that, but Vibrio is definitely one. And when that happens, it can be limb-threatening for sure. And so that's the skin is soft tissue method. Now it can still get in your blood and cause what's called sepsis and make you sick, and you can even die from sepsis when it starts from the limb. In particular, people who are immune suppressed, that's where you're at risk. Again, I don't want to scare everyone. It's not like no one can go out and enjoy the water. You can, and if you have a normal immune system, for the most part, you have nothing to worry about. But if you're immune compromised or sick or ill in any way, and you do get this inoculated in your body, it can be bad for sure.
And I think an important point. It's a continuum. So it's not just you either have a compromised immune system or you're healthy. It doesn't necessarily work that way. As we were talking about before the show started, alcohol could play a role in making you more susceptible. Let's talk a little bit more about that.
Yeah, for sure. So traditionally, when we say immune compromised people, we mean people who are on chemotherapy with cancer, and that's definitely a risk factor. People who have, say, AIDS from HIV, and that's definitely a risk factor. Even people on high dose steroids. But something unique about Vibrio is you need a healthy liver to help prevent the spread, whether it's from ingestion or from a cut or a scrape. And not exactly clear why, but for people who work their livers out really hard or have liver disease, that's definitely a risk. And so I have seen life threatening. I have seen people die from Vibrio. I have seen people lose an arm or a leg from Vibrio. And they really didn't have a traditional risk factor. What they had was they just drank a lot of beer. And so if you're a regular alcohol drinker, a regular beer drinker, you could be at risk. And so I would definitely add that to the category of something to be concerned about with Vibrio.
That is really important. So let's say you have a nick, or maybe you get a nick when you're in the water fishing or whatever it might be, and you clean it out as you normally would do on something like that. What you're suggesting is pay very close attention to it. If you see anything abnormal, don't wait. And that's one of the issues with Vibrio, incidentally, isn't it? That it spreads rapidly.
Yeah. Yes, exactly. Don't wait, and don't wait for the healthcare provider to ask you about the brackish water or ocean water exposure. Tell them right away. And I also add to that, shrimp. We had a real bad case of Vibrio this last month, and all the patient did was go down to the docks and buy shrimp, and then peel and prepare the raw shrimp themselves. Um, and then let's get back to the other way, which is the ingestion too. So, and it really is the raw oysters. When you cook them, it really does kill most, if not all of it. And so, it's really the raw oysters. So if you enjoy raw oysters, just wait till it's cool outside. Otherwise, if you eat them charbroiled, then that clearly minimizes the risk. But
And you're
again,
looking for an
if
internal.
people,
Yeah.
go ahead.
Yeah. I was just going to say, you're looking for an internal temperature about 145 or something like that, aren't you?
Yeah, yeah, I'd have to look that up to verify. But yeah, you definitely want them hot enough to potentially burn the roof of your mouth when they're done cooking. Um,
Let's do
but for
this. We'll
sure.
pick it
But
up from right there. We'll pick it up from right there and talk about cooking seafood and some other things you can do as it relates to avoiding it. And then we'll actually shift gears at some point in the next segment and talk about the other. We'll see you after this. Welcome back to the Ricky Matthews Show. We have an old friend of the show, Dr. Nicholas Conger, who was sort of part of this show during the entire COVID situation. And incidentally, Nick, I look back on a lot of the advice and approach that you took, and it really was terrific to have the knowledge of looking back, all the knowledge and see some of the things that you said and some of the things you said we should be skeptical of or whatever. You did a great job at that, by the way, and we appreciate you being available to us. We're talking about Vibrio, though, as it relates to water and food. And, I had actually one more category. If we were to, of course, hurricane season not over yet, but with post-storm and flooding, we have to be aware that Vibrio could be a risk because a lot of people are going to be out doing things and they might get scratched or whatever it might be. But let's finish that part of the conversation and then we'll shift gears and talk about this really important parasite that can be in game meat.
hmm yeah, so yeah, I was going to finish with, it's not always just the cuts and the scrapes too. It is the ingestion. And so I've seen cases of relatively young, healthy people that just had a big weekend where they just drank a lot of beer with their buddies and ate a lot of raw oysters, and they come in septic in the ICU with Vibrio in their blood. And so you're not going to have that necrotizing fasciitis wound. They just look sick, and they have this kind of faint rash. Now they generally get better if that's the case. Again, if you're not immune compromised, but it could definitely get in your bloodstream pretty quickly. Again, if your liver is being kind of banged on by that alcohol at the same time as you're exposed to the organism.
Yeah, and I think about when I'm out at the islands, let's say Horn or Ship Island, and people are out there in their boats and they're having a good time and they're drinking a lot of beer and they're standing in that water and it's warm, and that's how stuff like that happens. I mean, you're just enjoying life and suddenly you get sick. And
Yeah.
I mean,
And this was a big year
sneaks up
because
on
it was
your.
particularly warm
Yeah,
this year.
yeah, it has.
Yeah,
It really
it was
has been.
particularly hot. Yeah.
That's because of this high that's been kind of centered over us. And we've been, and, in that respect, it's hurt and what you and I are talking about now, but it's also helped us when it comes to
Yeah.
storms. It's been such a quiet hurricane season. Thank goodness. And I hope it
Yeah.
remains
Yeah.
that way. That's for sure. Anything else you want to say about Vibrio before we shift gears?
No, that's fine. We can switch to toxoplasmosis. Another thing that we had a little bit of a mini outbreak of last year for sure.
Well, let's do it because I think there are a lot of people who listen to the show who are outdoorsmen. They enjoy being in the outdoors, and they wouldn't normally sense that something like this would be something they need to think about. But boy, is it, isn't it?
Yeah. So, I learned about toxoplasmosis in school and in the books and in my fellowship training, and you learn about it in regards to kitty litter, so cat feces, and then raw meat if you eat undercooked meat, and that's kind of the big things everyone worries about. And they worry about a pregnant woman changing a cat litter box, catching toxoplasmosis, could go to the baby in her womb, that sort of thing. But last year, I get patients sent to me for fever of unknown origin. That's a big one. Like, we can't figure out why this person's having fevers. And I saw this guy and he was having fevers, and they were going on for a month. And checked in toxoplasmosis on my checklist. So I check it and it's positive. And I talked to him, and he was a hunter, and he ate deer heart, and he enjoyed he described it as flash fried deer heart, and shared
Yeah.
it with all the guys that were with them, and they almost all got sick to some degree. He got the sickest, but I find out he ate the most, and he was the oldest, and so toxoplasmosis is kind of weird. Like, you can get very mild illness, your body can tuck it away, and you have no problems, or you can get sick and have fevers and get really sick until you get treated. And that was the first case of, like, we had like 7 cases of toxoplasmosis in one year. Now I usually see about one every 2 years, and almost all of them were associated with hunting. Most of them were eating deer heart, most of it undercooked, but some of the people just participated in the cleaning of the deer, and some just ate the deer meat as sausage and other things. But clearly, it was a
Yeah.
big year for the deer to transmit toxo.
Well, Toxoplasma, I actually looked it up, and it cannot survive if cooked at 160 degrees. And what's interesting about that is that, typically with game meat, especially if you're thinking about like a deer tenderloin or something like that, the notion about flash cooking is kind of like what people like to do: sear it real, a little bit on the outside, and let it be kind of raw on the inside to some extent. And your advice is, as good as that sounds, you better be careful.
Yeah, and so a lot of people give their deers to someone else to clean, and they don't feel like they're at risk. But if you turn around and eat the meat undercooked, then yeah, that can put you at risk. And then if you're going to do it yourself, like, again, some people are like, oh, I didn't eat any, but I cleaned it. Well, if you clean it, if you wear gloves, you can expose yourself that way too. And so yeah, so I looked it up, and there's some case reports of this in the north, but never this far south. And so yeah, it's kind of want to get the word out that, again, there's nothing wrong with enjoying those activities and doing all that. Just be careful about it. Got to keep gloves on when you clean the animals, and wash your hands. And then I know people enjoy the very very shortly cooked meats, but thoroughly cooking game meat is always recommended.
The other thing I read was that freezing the meat for several days can kill the parasite, and
Hmm.
pregnant women and immune compromised individuals should avoid it altogether. And people should
Yeah.
look it up. It's spelled the way that it sounds: toxoplasmosis.
Hmm.
Toxoplasma is the name of the
Hmm.
parasite. So we're out of time, but man, it's been a pleasure, Dr. Conger, to spend some time with you.
Yeah. Hey, I had a great time. Thank you for having me back. I really appreciate the opportunity to share some of these things that might affect our community and your listeners. So I do, and I appreciate kind of the long form conversation. So thanks.
Yeah, you're really good at it. You're really good at it. Listen, have a great day, and we will see you tomorrow.